Type 2 diabetes is a chronic condition that needs monitoring and treatment throughout your life. But people with this condition can lead full and active lives. And there are things you can do to lower your risk of serious problems. Let's start with some of the basics. When you eat, food gets broken down into a few different things, including glucose, which is a kind of sugar. Once broken down, this sugar flows into your bloodstream and is turned into energy for the body. But your body can't turn sugar into energy unless the sugar gets into the cells, and it can't get in without a key. So think of insulin as the key. Insulin is a hormone that's made in a long, thin organ in the abdomen called the pancreas. Insulin unlocks the cells and lets the sugar in. Once inside the cells, the sugar can be turned into energy. But without insulin, the sugar may be locked out. It then builds up in the bloodstream. Most people with type 2 diabetes make some insulin, but they do not make enough to keep their blood sugar in a normal range. And the body does not respond to insulin as much. It becomes resistant to the insulin, so sugar builds up in the bloodstream since the key doesn't work as well. Over time, this can cause serious problems in your body. Unfortunately, over time, diabetes can take a toll on your body. With diabetes, the blood vessels to the eye may become damaged. You may hear this called retinopathy, and this can cause major vision loss or even blindness. Unfortunately, diabetes can also affect your kidneys. Your kidney's job is to filter waste from your blood and make urine. Urine carries waste out of the body. Over time, too much sugar in your blood or high blood pressure can hurt the tiny blood vessels inside your kidneys. And if this happens, your kidneys can't filter your blood as well as they should. Waste can then start to build up in your blood rather than leaving your body as part of the urine. And this can cause serious problems with your kidneys. Your nerves can also be affected by diabetes. Your nerves let you know when something feels hot, cold, or painful, things like that. But if diabetes has affected your nerves and they aren't doing their job well, you might not feel something like a cut on your foot. Cuts or injuries on your foot may get infected. Unfortunately, a really bad infection can lead to serious problems like losing the foot or leg. And when diabetes affects your nerves, it may cause pain, burning, or a tingling feeling in places like your hands and feet too. Your heart can also be affected by diabetes. Over time, the blood vessels that carry blood to your heart can also get damaged. Now, the blood vessels that feed the heart are called coronary arteries. If one or more of these vessels gets blocked, blood can stop flowing through it, and this can cause a heart attack. And heart attacks can lead to heart failure, where your heart can't pump blood as well as it should, or even death. And unfortunately, diabetes can also block blood vessels to the brain, which could cause a stroke. But thankfully, there are things you can do to lower your risk of these problems happening. Eating healthy foods and participating in regular physical activity are some of the best things you can do to manage type 2 diabetes. To start, eating well and managing your blood sugar go hand in hand. If you have questions about what you should eat, meeting with a dietitian can really help. A dietitian will help you create a personal meal plan, and a good plan balances what you eat with your medicine and activity. This isn't about changing everything you eat. It's about making small changes that can add up over time. Getting regular physical activity is also great for your health. If you do not get regular physical activity now, try looking for ways to fit more activity into your regular day. Then you can add more over time. For example, if you go to the grocery store, try parking away from the entrance instead of right out front. That way you have a few more steps to take. And as you get used to moving more, you may find you want to set aside time to go around the block 2 or 3 times each week. This may seem like a lot if physical activity isn't a regular part of your life, so start slow. After a while, you can add a couple more blocks, then a couple more. Pretty soon you can work your way up to being active for 30 minutes at a stretch. And that's your goal, to walk or do another kind of activity for at least 30 minutes, 5 days a week. But if you are not there yet, start slow and build up over time. And before you start any activity plan, Please talk to your doctor or diabetes care team. You may also notice that you lose weight. But changing old habits can be really hard, so keep in mind, you don't have to tackle all of this at once. Talk with your doctor and pick one thing you want to work on now, like doing more walking, and focus on that. Then, at your next appointment, you and your doctor can discuss how this first change is going and talk about what you'd like to try next. But whatever change you decide to make, remember, you don't have to do this by yourself. Friends and family and your care team can help, and you can find support groups in your community and online. You just need to take that first step. Another important step you can take to stay healthy is to regularly check your feet for cuts. Here's why. If your nerves aren't working well, you may not notice something like a cut. And because blood vessels may also be damaged, it can take longer for the cut to heal, which can lead to a bad infection. Since the feet take a daily pounding, it's important to check them every day. Check for blisters and sores. If you can't see the bottoms of your feet, try asking a family member to check them for you, or use a mirror. And make sure your toenails are filed or cut straight across. You don't want any sharp edges that could cut your foot. This also helps prevent ingrown toenails. Also, it's very important to wear shoes that are comfortable and fit well so you don't get blisters. In fact, to help prevent foot injuries, it's a good idea to wear your shoes or hard-soled slippers or clogs, if you prefer, all the time. That includes when you're out in the yard or just walking around the house. Protect your feet and make sure you check them. Next, let's talk about smoking. Smoking is one of the most damaging things for people with diabetes. Diabetes already affects your blood vessels, and smoking puts even more strain on them. Among other things, your chance of having heart disease or a stroke goes up when you smoke. So if you smoke, really think about quitting. If you've tried before and it didn't work, you're not alone. It can take many times before it sticks. One combination that's been shown to be very successful is using things like nicotine patches or medicine, along with a support group or counseling. This combination can double your chances of quitting for good. And the good news is that once you cut out smoking, your risk for a heart attack and stroke drop very quickly. This is true even if you've been smoking for 30 years. Okay, your doctor may also ask you to check your blood sugar regularly at home to help manage your diabetes. Has your doctor asked you to check your blood sugar at home? If you're not sure, ask your doctor what they recommend for you. There are a few different reasons why your doctor may want you to closely monitor your blood sugar. For example, if you take certain diabetes medicines or insulin, your doctor is more likely to recommend this. Most people with type 2 diabetes who monitor their blood sugar use a blood glucose meter, so let's start with that. Blood glucose meters use a small blood sample from sticking your finger. The meter measures the blood sugar level in the sample. Your meter might keep track of these readings, and some people write them down. But recording them is important, so you can see how your levels change based on what you eat, the medicines you take, and your activity. How often and when you check depends on many things, but you and your doctor can figure out a plan that works for you. If you're not sure when you should be checking, just ask your doctor. Once you have a schedule, try to stick to it. If pricking your finger becomes too uncomfortable, ask your doctor if occasionally checking in other places, like your palm or your arm, is an option for you. Just keep in mind that checking this way may not be as accurate. Some people with type 2 diabetes who take insulin may use a continuous glucose monitor, or CGM. A continuous glucose monitor is a system that checks your glucose or sugar levels in the fluid under your skin instead of through blood from a finger prick. It is worn on the body, so it can continuously record your sugar levels throughout the day, every 5 to 15 minutes, depending on the monitor. Some of these monitors have alerts for low or high blood sugar levels. This can help give an early warning and help treat low or high blood sugar earlier. But insurance companies may not cover certain types of continuous glucose monitoring devices. Ask your doctor if you have any questions about this option. Okay, let's quickly review low blood sugar or hypoglycemia. In the early stages, low blood sugar may make you feel sweaty, lightheaded, shaky, hungry, anxious, or you may get a headache. This can happen if you skip a meal or eat less than normal during a meal. You're more active than usual. You drink alcohol on an empty stomach, or you accidentally take too much medicine. If you feel signs of low blood sugar, check your level as soon as possible. It's important to treat low blood sugar right away. To treat low blood sugar, you need something that gives you sugar fast. There are chewable glucose tablets and flavored gels you can keep in your bag, pocket, or car for times like this. You can eat 3 or 4 glucose tablets, 6 to 8 hard candies, or drink a half cup of fruit juice. But if this doesn't help, seek emergency help right away. And if your blood sugar is low a lot, tell your doctor because this can be life-threatening, and there are steps you can take to keep yourself in a healthy range. A good place to start is to check your blood sugar regularly and record those numbers. Some people can manage their type 2 diabetes through activity and the foods they eat alone, but many people need to take certain medicines as well. One common medicine people take is called metformin. Metformin is low cost and works well for most people. It helps your body respond to insulin better and helps lower blood sugar levels, but even though it works well, sometimes metformin isn't strong enough on its own to keep your blood sugar in the target range. So some people take insulin or another kind of diabetes medicine to help. No matter what, you and your doctor will talk about your medicines and make a plan for what you should be taking. But for now, I'd like to talk about some other important medicines for some people with diabetes, namely ACE inhibitors and ARBs. People with diabetes and kidney problems or heart problems may need to take an ACE inhibitor or an ARB. These are commonly used medicines to help manage blood pressure and help slow down kidney damage. Your doctor may also recommend other medications called finerenone and SGLT2 inhibitors to help protect your kidneys. Okay, many people with diabetes may also take a statin, which is a medicine that may help lower cholesterol and the risk of things like heart attack and stroke. If you're not already taking a statin, ask your doctor about whether they're right for you. Aspirin is another common medicine that may help some people with diabetes. Aspirin helps keep blood from clotting, which lowers the chances of blood vessels getting blocked. So people who have diabetes and have had certain heart problems may benefit from taking aspirin. Ask your doctor if taking a low-dose aspirin every day is right for you. But just so you know, if you're at risk for serious bleeding, you probably shouldn't take aspirin. Getting sick can be harder on people with diabetes, so it's important to protect yourself by getting your vaccines as well. The COVID-19 vaccine and the flu vaccine are important in helping you stay healthy. These vaccines will not give you COVID-19 or the flu. You may feel unwell a day or two after getting these vaccines, but this isn't you getting sick. This is your body responding to the vaccine. So don't be alarmed. These feelings should go away in a few days. And lastly, be sure to ask your doctor about getting a pneumonia vaccine. You only need it a couple of times in your life, but it's one more thing that will help keep you healthy. You can also ask about getting vaccinated for hepatitis B. This can also help keep you healthy. At this point, do you want to make any notes? Okay, let's move on. Let's review some things you can do throughout the year to help you stay healthy. First, it's important to visit your doctor and get your A1C or glycohemoglobin checked. In general, people with type 2 diabetes whose blood sugar is at their goal should have an A1C test every 6 months. But you may need to check it more often if your blood sugar is not well managed or if your treatment changes. The A1C helps gauge how well your sugar was managed over the past few months. It's how to find out if what you're doing every day is working, or if you and your doctor need to change something. And usually the goal is to have an A1C less than 7. But you and your doctor may have a different goal for your A1C. If you're not sure what your goal is, talk to your doctor. You may also need to get your cholesterol checked on a regular basis. There are a few kinds of cholesterol. One main kind of cholesterol is called LDL. You want your LDL to be low, so think L for low. When there's too much LDL cholesterol in your blood vessels can get blocked. And this can lead to a heart attack or a stroke, which are already big risks for people with diabetes. Also, at least once a year, your doctor may check how your kidneys are doing. Since diabetes can damage your kidneys, it's important to monitor how they're working. Your doctor may do a urine test and a blood test to check this. Also, along with checking your feet yourself every day, it's important for your doctor to take a good look at your feet at least once a year. Your doctor will check for cuts, sores, and blisters. They will also check how well you feel things and how well your blood is flowing to your feet. Having your eyes checked regularly is extremely important too. Your doctor may recommend eye exams every 1 to 2 years. Most likely an eye doctor will do the exam, or your regular doctor may use a special camera to check your eyes instead. These tests let your doctor see early signs of any eye disease. Getting your eyes examined regularly helps you catch problems early, and treating eye problems early can help save your eyesight. And if you ever start to have trouble with your eyes, see your eye doctor right away. Okay, your blood pressure should be checked at every office visit, but your doctor may want you to check it more often. Blood pressure is measured with 2 numbers. In general, doctors recommend keeping your numbers below 130/80. If this is your goal, then your blood pressure would be high if the top number is 130 or more, or it would be high if the bottom number is 80 or more. But be sure you know what your blood pressure goal is, because it can be different for different people. Unfortunately, high blood pressure or hypertension can hurt the body in lots of different ways. But if you stay on top of your blood pressure, you can help manage it. And you don't have to wait until you visit your doctor's office to check your blood pressure. Many supermarkets and drugstores have machines that let you check your own blood pressure. And you can even buy low-cost machines so you can check it at home. The best kind are the ones that pump up automatically. But the kinds you use on your finger or wrist are not very accurate. So look for one with a cuff that goes over your arm. And be sure to sit and relax for 5 minutes or so before you check your blood pressure. That way you'll get a more accurate reading. And if it seems like it's usually higher than your goal, contact your doctor. Okay, it may seem like there's a lot you need to do to manage your diabetes, but remember, your care team is here to help. And a lot of the things you need to do are just once or twice a year. So try to focus on just a few important changes you can make so they become daily habits. And when you do that, you could lower your risk of serious problems from diabetes.